Hi, I'm Dr. Del Goodrick, and this is a unique dental experience here in Santa Clarita, California. One of the things that I see patients for oftentimes is bite related, and that has to do with how their teeth come together. Sometimes this can cause worn teeth, it can cause broken teeth, it can cause chipped teeth, it can cause even joint pain and temporomandibular joint dysfunction. We call this occlusal disease. Occlusion has to do with how the teeth come together. And so there's a lot of musculature that is trying to fine-tune your bite so that when your teeth come together, that they all ideally would hit equally and be balanced left to right and front to back. Unfortunately, that's not always the case, even after orthodontics. So with orthodontics, a lot of times the teeth will look great, they'll look like they're in alignment, but there might be some little idiosyncrasies where the teeth just might contact early on one side or not at all on another side. One of the instruments that we have at our disposal for patients who come in either exhibiting symptoms with their jaw or even having a lot of dentistry done, full mouth dentistry done, is that we have a device that measures force over time, and so it will tell us what tooth hits first and with how much force. So this is real important information when we're trying to get somebody dialed in, either maybe that is having multiple implants placed or even just fillings done around their mouth, because maybe you can recall having a filling done or a crown replaced or something like that, and your bite just didn't feel right, and it causes the tooth to be uncomfortable and tender and symptomatic, sensitive to hot and cold, and you just can't really bite on it, nothing hard anyway. So this is the tech scan. It consists of a thin plastic sensor, and this sensor is in a device here. This little pointer here is stuck between your two front teeth, and then it does what we call a movie. And so it starts running the memory just like the video recorder is doing right now, and then we have the patient clench into it, okay? And that measures that, and we can see where the first contact is and then how much force there is. And then some of the other information it gives us is how quickly the patient can bite and release, and you know, whether that's balanced left to right or front to back. And so we have an example up here on the screen of some of the information that it gives us. And so if you look at that arch form, it would be like that, okay, the patient's mouth. And so we can see, you know, all of the areas where that is hitting, and then in this freeze frame right here, it shows that a lot of the forces where those skyscrapers are on the left side. If we look in this box here, we can see left side, right side, and we have another little indicator that shows us in real time as the patient is biting, and I can play this for you in just a moment, that we can see where those forces are located. Ideally, we would love to get them right in that bullseye right there. So let me go ahead and play this for you, and you'll see it measures it in hundredths of a second. And so we really can, you know, quantify this. It's a great tool to start using with the patients, because we'll put the information up on the TV screen, and once they start thinking about how their teeth come together and then they can visualize it, then it makes it really interesting to help get them dialed in. And we have patients come in here with migraine headaches. You know, they've had chronic problems for a long time, and we can get them dialed in, so at least dentally there is no contribution to those migraines. And here comes a clench. You can see the forces build, and you can see where all that force was mostly on the left side here. And then so we can stop this at any point too, and so it really helps us to equilibrate it. So, and in equilibration, it's not always shaving down the tooth or taking away. In some cases, we actually add bonding material to build up a tooth. And so you might see somebody whose teeth, you know, aren't properly aligned, and they may have, you know, kind of a sway or something because they've been missing a tooth or whatnot. And so we might be able to build that up so that it is even, and that top tooth and bottom tooth can hit and simultaneously with the other teeth, and so that way we get some balance. When we have that balance, then we don't have to worry about the jaw joint, which is loose at both ends, being destabilized, so it helps to stabilize it. So this is the tech scan. We offer it here at a Unique Dental Experience, and it's one more facet of the best care that we can provide for our patients, so that we can make everything work functionally and aesthetically. Thank you.